Hello Kadar orthodontic patients, family and friends. I want to take a few minutes to share with you all the precautions we have in place to protect our patients and team members from the transmission of infectious diseases from colds and flu to more serious contagions like the coronavirus. Dentistry, including the specialty of orthodontics, has always had a very high standard in sterilization, infection control, and environmental asepsis, along with an excellent record in preventing the transmission of bacterial and viral diseases. In fact, as I hope you'll see in this presentation, the Kadar cabinet is among the cleanest places you'll visit in the course of your day. I'd like to introduce my wife Lori, a registered nurse, who will review the procedures that keep our patients and staff members healthy and safe in our office.
Hello, I'm Lori Kadar. As a nurse, it's my responsibility to make sure that all of our clinical and administrative teams are properly trained and adhere to all CDC guidelines for infection control, universal precautions, and environmental disinfection throughout the office. Let's begin with standard universal precautions. This is an approach to infection control to treat all human blood and saliva as if they were known to be infectious with viruses and other blood-borne pathogens. Since the coronavirus pandemic, we have expanded our clinical precautions to include enhanced OSHA and infection control training for all Kadar team members, daily staff screening for illness or fever, laundering of uniforms and gowns, and policies on footwear, expanded hand washing policies for all staff and patients in the office, barrier protection with personal protective equipment or PPE, including masks, eye protection, face shields, and gowns for all clinical procedures, peroxal oral rinse for all patients prior to any orthodontic procedure to kill bacteria and reduce spread of infection, operatory disinfection. Our clinical chairs are at least 8 feet apart, and we have 4 private rooms available for further isolation as treatment dictates. In addition, we have always used CDC and OSHA mandated cleaning and disinfection protocols for all surfaces in our treatment area, including chairs, dental lights, and cabinets. We use broad spectrum disinfectants that kill bacteria, viruses, and tuberculin spores on contact. They are the same products used in hospital surgical rooms, anesthesia machines, and respiratory therapy equipment. Ultrasonic cleaning and sterilization of all instruments, including ongoing spore testing and waterline cleaning and disinfection. And remember, at every visit, we use a sterilized cassette system of instruments specific to each patient's needs. Dental aerosol reduction. We have expanded the use of high-speed suction instruments and handpieces that help reduce aerosols throughout the office.
Thanks, Lori. In addition to the infection control standards we have always maintained, we recently added many new safety protocols. Reception area infection control, including automatic door entry, simply wave your hand for entry, plexiglass dividers, and social distancing signage. Text-to-treatment or curbside check-in, patient pre-treatment screenings for signs or symptoms of illness or infection and face mask requirement, HVAC system. Since our building is brand new, we already have a highly efficient airflow system with up to 10 exchanges per hour. We chose to enhance the system with installation of UV lights in all HVAC units to inhibit growth and reproduction of germs and bacteria within the air that circulates within the cabin. Air purifiers, strategically located in the office to purify and neutralize airborne, mold, bacteria, viruses, and fungi. Washable keyboards and mouse sets were installed in the clinic to further reduce transmission of infections.
Here's what you can expect at your next in-office appointment. To minimize the number of patients in the office, we've implemented our text-to-treatment or curbside check-in process. When you arrive for your appointment, please text us at 856-582-1400 with the patient's name. We will respond with instructions on when to come in for your appointment. Once we respond by text, we will ask that only the patient comes into the office for the visit. All patients must wear a mask inside the office. Upon entering the office, everyone will be asked to wash their hands with soap and water or hand sanitizer. Next, our clinical team will review some basic health screening questions and take the patient's temperature. All patients will be escorted to the clinical area where they'll be asked to rinse their mouth with an antibacterial mouth rinse. Upon completion of the visit, a next appointment will be scheduled and sent electronically to the responsible party. Should scheduling changes be needed, please text, email, or call us. No paper and no contact needed. Many patients like using the My Orthodontist app on their smartphone to view our appointments, make changes to their appointments, see photos, x-rays, and educational information. The most impactful improvement we have made is expanding the use of virtual visits in our office. Our patients simply send pictures from their smartphone and get treatment updates right from the comfort of their homes. We can even do HIPAA-compliant Zoom healthcare visits, which are live discussions about treatment or any other patient concerns. Virtual visits are a great way to keep your orthodontic treatment moving forward when you can't get to the cabin.
My name's Diana. I've been a part of the Kadar team for 36 years. I'm also a mom, and I had 2 kids come through the practice, and they both had beautiful smiles. But I wanted to let you know that our sterilization and our disinfectant techniques go above and beyond, and you can feel comfortable bringing your family here too.
Hi, my name is Kim. I've worked for Dr. Kadar for 18 years now. Both my children are patients at Kadar Orthodontics. I feel proud and confident of the steps that have been taken to protect me and my family.
It's been my pleasure to serve the South Jersey community for nearly 3 decades. Protecting the health and safety of our patients and staff has always been my #1 priority, now more than ever. Thousands of families have entrusted us with their orthodontic care, and we will never take this trust for granted. Our standard is to treat our patients like members of our own family. If you have any questions about our procedures, please don't hesitate to contact me personally at drtom@gokadar.com.
Thank you for being a part of the Kadar Orthodontics family.
We'll see you and your Kadar smile soon.